National Black Nurses Association Population Health Committee. Today, our meeting is a series of webinars on having candid conversations. And the candid conversations are about, unfortunately, is candid conversations about the prison and the boomerang effect on the Black community. Today, we're going to be focusing on what happens to our mothers, our sisters, and our daughters in the prison system. Today, I would like to introduce to you our panelists, and I want to start with Ms. Lori Reed. Ms. Reed is the Director of Nursing at Right at Home Atlanta and a correctional nurse consultant in Atlanta, Georgia. She is a retired military and uniformed service officer, having served in the United States Army and the United States Public Service. Ms. Reed's nursing career spans 37 years and includes correctional health nursing since 1997. She served as a correctional health expert for the Centers of Disease Control and Prevention and is currently a correctional health consultant and prison health auditor for the Department of Justice Agency. Thank you so much for joining us today, Ms. Reed.
Thank you for having me.
You're welcome. Next, I would like to introduce to you Ms. Joan Smith. Ms. Joan Smith will be doing a recording that we will share along with the evaluation on different statistical data. She's had more than 15 years of experience in the nursing profession. She's currently a nurse practitioner. As a nurse practitioner, she is very, very passionate about health promotion, disease prevention, and she is passionate about working with the underserved, vulnerable population. She's been recognized as the equity champion by the Satcher Learning Institute of Morehouse Medical School. And the last person on our team is none other than Dr. Pierre Brodnix. Dr. Pierre Brodnix has had over 40 years of experience as a professional nurse, as a direct provider, a mentor, educator, as well as administrator. In these roles, she has served as an advocate for different types of community-based settings and mentoring faculty as well on all levels. She is well sought after as far as speaking on various topics as to giving quality healthcare for all citizens. Dr. Brodnix has assumed many leadership roles working with health policies, advocacy through health policy councils, professional organizations, and national initiatives. She's served in many leadership roles. She's also served as the interim director of health services for the District of Columbia Department of Corrections, which includes 7 prisons, a detention center, and a treatment center. Thank you so much for each person being on the panel. And I have to say, the Ad Hoc Population Health Committee on Prison Reform and the Homeless Population, composed of myself, Dr. Brodnix, and Dr. Smith. And that is why we're doing a series of webinars on this important topics. Before we jump into everything, I want to get started with just a few stats on what's going on with the prison system. Between 1980 and 2020, the number of incarcerated women increased by more than 475%, rising from a total of 26,326. In 1980, that number increased to 152,854 in 2020. The total count in 2020 represent a 30% reduction from 2019 because they had a substantial but insufficient downsizing in response to COVID-19 pandemic. But guess what, guys, everybody? A lot of the states are reversing this. In 2021, they started reversing the downsizing. So it's going in the opposite direction. Research on female incarceration is critical to understanding the full consequences of mass incarceration, and also to unraveling the policies, the practices that lead to their criminalization. So the number of incarcerated women was nearly 5 times higher in 2020 than in 1980. Though there are many more men in prison than women, the rate of growth for female imprisonment has twice as much higher than it is for men. As of today, there's over 1 million women under the supervision of the criminal justice system. Think about that. Let that sink in for a minute. So I want to get started with our questions. And my first question would be for Ms. Reed. And my question is, could you talk to us about what do you think is the greatest healthcare challenge facing women in prisons?
Thank you again for having me and welcome everybody. That is, I'm going to say it's a loaded question to start off with, because it's a lot of issues that could affect them. And one of the things that we need to understand is that our prison system was actually designed for males. It was never really designed for females. So it's built on a male-specific model, leaving a lot of facilities really not prepared to meet the biological, the psychological, and the social needs of women. So the infrastructure in and of itself poses a challenge even before you start talking about the specifics around any kind of physical care, any kind of mental health needs, any kind of any kind of social needs that are met by the women. And this actually has just contributed to a negative health impact. So specifically, there's no really specific diseases, so to speak, but it's just the infrastructure is probably one of the largest impediments to the healthcare system. But I do say that in most facilities, especially in your prison systems, not necessarily always in your jail systems, because I want people to understand there is a prison system and there is a jail system, and they're run by different entities with different budgets. And what your budget gives you allows you to actually do what you can do. But for most women, we do try to meet those unique healthcare needs. But honestly, it can be a challenge. But we're doing very well with what we call gender responsiveness to most of our females.
Thank you. Thank you. Appreciate it.
You're welcome.
Dr. Broadnax, I have a question. What are the historical and modern implications of racial disparities among female offenders?
Historically, we have believed that there were more African American women in prison than other races. So the disparity was like inherent in the numbers of the races and ethnicities of women who were incarcerated. And now you see that there are increasing numbers of white women who are incarcerated as a result of drug-related offenses. And you also see large numbers of Hispanic women, but you cannot distinguish the ones who have been here versus ones who are newly arrived incarcerated women, because we know that newly arrived women would have trouble with having difficulty getting their finances met. So they may result in committing criminal activity. So when you see the diversity, or when you read the statistics, you have to really take into consideration what's going on in the community and how it's reflected in the incarcerated population. It's not as simple as one would think. It's all this race or all this ethnicity, and we have to do something because the societal needs are driving the incarcerated rates, which are different from those driving the incarceration rates of males.
Wow. So I have a follow-up question, and this question would be for both of you guys. Well, what does the economic and educational backgrounds of most females offenders potentially reveal about their offending history? Because like you said, it has to do with the community, your background. I mean, did they have a college education? Does that make a difference if they're educated or not? So who would like to take a stab at that first?
I can
stab
start.
is
Right, and
Fine.
there are, and I will also tell you that there are some folks on here who could help answer that question, but I won't call them out because I see them they join. But in general, poverty, low educational attainment, and for women, you will add in trauma, domestic violence issues, psychological issues. A significant number of our inmates and detainees are under some sort of mental illness. Not everybody is treated medically for it, but we have a lot on that DSM axis 1, axis 2 that are treated with psychotropic medications. So poverty is a big deal. For example, in a jail setting, which is very short turnaround for most people don't serve time in a jail. However, there are people who are able to get arrested, and with the proper funding and they can bond out, or in most cases among Blacks, both men and women, a lot of them are not able to come up with those funds, or family members aren't able to come up with those funds to meet that, and they end up staying. So it varies from, just like Dr. Broadneck said, it's going to vary from state to state, and within the state, it's going to vary from county to county. In Atlanta, we've got 159 counties. The majority of our populations are coming from Fulton and Cobb County in our system, where our largest Black population is. Our recidivism rates are high, and our rates of them being able to bond out are low because they just don't have the funds. You go south, it's a different story. The turnaround is maybe 8 hours, 12 hours.
Wow. Dr. Broadneck.
And again, it would be difficult to factor out the impact of education. For example, in the District of Columbia, the prison system was dismantled, and those who are sentenced within the district are sent throughout the country. So if you know anything about the District of Columbia, there is a low graduation rate in the public school system. So you will see that which is reflected in the incarceration rates of the inmates. And you will see a higher rate of African Americans, because we are predominantly in city of African Americans, who also have low graduation rates from the public system. So it's difficult to factor and make a blanket statement about the impact of education and socioeconomics on increasing or the rates of incarceration. Also, when you look at the rates of whites who are incarcerated, it is, again, not necessarily tied into socio-demographics or education rates, because people are incarcerated really as a result of their connectiveness to drug activity. And the type of drug is actually a reflection of what's going on in their community. In urban communities, you see more of the cocaine and fentanyl and other drugs, and in rural communities, you may see more methamphetamines. So it's even difficult to get a true picture of what's going on in terms of who is being incarcerated.
Mm-hmm. Thank you. My next question would be based on the fact that, as you guys are both saying, most women are incarcerated, not only women, but men too. Most of it, of the offenders, they're drugs. They're due to drugs. So now you're in a prison system. How is that going to affect the person mentally? I mean, what are your views on the mental health of these individuals? On the outside, maybe they had a $200 a day habit or something like that. So how does it affect them, their mental health in a prison setting? Ms. Reed, what do you think?
Well, I take every question. It seems like we could have done our own topic on and a 1 hour on each of these topics.
I know.
You can do an hour on mental health. Many of the women, since we're focusing on women, many of women who have been incarcerated really have a history of addiction, domestic abuse, sexual violence, in addition to the trauma that just comes from being arrested or just comes from being incarcerated. So you take all of those things that they bring with them, and our women do bring a lot of baggage. Very few have none, and I mean very few. I'm going to give you Martha Stewart, probably the one that would come in with none. Most of our women are coming in with all of those. So that trauma, the substance abuse, and mental illness from being in prisons, oftentimes we can only do but so much inside. We can only do but so much with mental illness. We can only do so much with trauma. But what we've tried to do through many various programs, such as our gender responsiveness programs, we tried to address some of those issues, everything from parenting to anger management to understanding that you are not your trauma. Those type of classes we try, but I will not sit here and tell you that that's offered in every system, because it's not. In our jail systems, it's probably non-existent, but their turnaround is much higher. So, some of your larger jails, 1,500 or more detainees daily, they probably do have some of those programs. Some of your smaller ones, they probably are non-existent. In our prison systems, we can focus on those, but they bring a lot of the trauma with them. We do the best we can to help mitigate. And then on the outside, we make as many referrals as we can and try to do the best with continuity of care. But as Dr. Broadneck, and we'll hear it again, it really depends on where you are and what type of wraparound services are actually going to be available. And we've been looking at this through the federal level, the state and the county level for many years. And we do have reentry programs that do exist, some of whom just cater just to women. And I'm glad Dr. Frances Ash Goins chimed in, but it's a myriad of issues that we do have to deal with.
Well, thank you. I'm going to share the question. Dr. Frances Ash Goins questions from the chat box. Please address the young women that are incarcerated due to the results of human trafficking and jail for prostitution. Can anybody speak to that?
When we think of human trafficking, the young women, and usually they are young women, are trapped or kidnapped and forced into prostitution. So when they are arrested, it is a result of this activity, plus being traumatized from being kidnapped and trained to perform as sex slaves in this human trafficking. So again, as Dr. Reed has mentioned, the services available are generally predicated by the budgetary allocations of that state. And if the state has not deemed this as a priority, then the services will be lacking. Mm-hmm. If they are incarcerated in a jail as a result of human trafficking and or prostitution, they will probably not be incarcerated there for a significant period of time and will be released, and hopefully, I can only say hopefully, connected to a community-based service that was specialized in supporting those young women who have been involved in this as a result of human trafficking and prostitution. And I want to say one thing about prostitution. In one of my other positions, I became aware that there were young ladies in high school who were prostituting and dancing in the not nightclubs, strip clubs, to earn money for the family. It was not something that they chose to do, but they felt that they had to do it because the family, the parents were maybe on drugs, and there was no source of income coming in to maintain shelter for the young lady and her siblings. So they would turn to prostitution and dancing in clubs.
Wow.
So it's not always, if you were prone to thinking that it was always a choice, a lot of times it is not. And one other thing I wanted to mention about the mental health, if you have some knowledge of the criminal justice system, you are not as traumatized when you are arrested. But can you imagine if you send, I'll just say your daughter, or if you have a sister who becomes involved with what we used to call a bad boy, or someone who's in the drug trade, but she is not in it, but is involved with the young man or older man, and is picked up as a result of his being arrested. And she finds herself incarcerated in the jail and may possibly sentenced for a number of years. Very, very traumatized, because you were going to college. Mm-hmm. You had hopes, and now you find yourself in prison. And not because you were doing drugs, but because you made the wrong choice in a significant other.
Yes, that could be very traumatizing. That could cause lots of mental health issues as well. In a situation like that, you just hope that you'll have a mentor or someone that could help you through that situation. So my next question would be one of the questions from the chat box. Have there been changes for healthcare for pregnant women while in prison, and what are the challenges? And to follow up, one of the questions I had was, and I'm curious, what is the protocol if you have someone in prison who is pregnant? What is the protocol for the birthing process of the women in prison? What is the protocol?
I'm going to answer that in two ways. One, I'm going to answer it as a nurse working in a prison system. I will tell you this: the first thing that I try to do is to see if we can get them discharged from our facility and back home. Let's start there. That's a priority, and a lot of that depends on the offense. A lot of that depends on the security level. A lot of that depends on other issues around why they were arrested in the first place. Howsoever, I say that to say, if they are, and we do a pregnancy test on everybody who's within an age coming into our system, they are offered a pregnancy test as part of that initial health screening in the facility. This is jail and a prison system. Those who we know for sure are pregnant, they are offered prenatal services, often on the outside. It is not feasible for most jails and prisons to have on contract in-house OBGYN. We do send those detainees out most of the time. We have had women who do deliver while they're still serving time in a jail or prison, mostly in prisons. There are very few programs. I can't think, one maybe in Kansas, where we do have some that are able to keep those children for a little while, but those are few and far in between. I think we only have 3 in the country. One I think might still be at Rikers. island. But for the most part, we do talk to them through a social worker about giving up that child to a family member preferably, or they end up going into some sort of foster care. It is not ideal to be pregnant in a correctional facility, but I say, and I don't mean it sarcastically, it's not ideal to rob, to kill, or to do other things as well. Unfortunately, there are some circumstances that cause you to get arrested. And then we do find out later that you're pregnant, and we deal with it as best we can. And we're pretty honest about that. Prenatal care is a requirement, especially among those who are accredited. So we do take care of them. And I know this may come up, and Dr. Broadneck can come in. I know there's been some conversation around the shackling, because I know we've gotten some questions about that. So we can go ahead and talk a little bit about that elephant in the room. We now have up to, I think it's 38 states that actually have policies and laws on the books where we do not shackle, with few exceptions, women who are pregnant and during labor. So this was a process that was being done. Back in 2018, there was a federal law that was passed, preventing the shackling of women who are in federal facilities. And understand that when federal laws are passed for detainees or inmates, they only apply to those in federal prison. That is not the bulk of our detainees. Bulk of our inmates are in state and county facilities. But there are about 2,000, there are about 400 federal prisons of the 2,000 prisons we have in the country that house federal inmates. So unfortunately, the flaw in that law is that it only applied to federal. However, the guidance was adopted by most states. We still have about 12 states that don't have any laws on the books for shackling, but there is an awareness in all 50 states, because we've done a lot of education with our correctional officers and with our correctional administrators about not just the morality, or not just what people have referred to as the savageness of those shackling, but also looking at the security aspect, but also looking at the health care and the welfare of the female. And it really all comes down to education and understanding, because in any facility, there's always going to be that issue with care versus custody. Because keep it real, we have some women, take those shackles off, you might lose your life. Now, I'm just going to put that out there as well. I'll let Dr. Broadneck pick it up from there.
Dr. Broadneck, thank you so much, Ms. Reed.
You're welcome.
As Ms. Reed has spoken about, we appeal to the compassion of the security administrators. But some people are not compassionate. So in addition to education, we also cannot minimize the impact of budgets. Because when a person, or when an inmate goes into labor at an outside facility, previously they had been shackled. Again, we're talking about county and state facilities. When they go into the hospital, a regular hospital, they must be accompanied by a security officer. So while in these 12 states who are silent on the issue of shackling, they shackle the woman to the bed, and the officer still must stay at the bedside. So you now are talking about staffing that one patient for as long as she's in labor. So while we have addressed the federal laws, or the federal shackling of laboring mothers, the county states have been less progressive in this area. And while there are standards for nutrition and prenatal care, again, not every state and county facility adheres to that. And so their lack of compliance will bring in Ms. Reed as a compliance officer to review and audit what's going on.
Mhm.
But even though their standards, with all that's going on in the world, incarcerated persons are not receiving the attention that they deserve in terms of the delivery of quality services, just basic. Are they given prenatal vitamins? Are they given adequate nutrition? Are they allowed to breastfeed upon delivery? So all of these standards are predicated on the decision-making of the correctional administrators and the county budget.
Wow. A few questions from the chat box. The National Black Nurses Association has approved a resolution dated in 2019 on healthcare on incarcerated women, which is great. And then I have a comment by Robin Bruce. It's very long. Would you like to speak, Miss Robin? Ms. Robin Bruce?
Yes, I suppose that I can.
Yeah, go for it.
We have a lot of initiatives out here in Colorado addressing mental health in the prison systems. We know that that need is not being met in prison, that we know have a lot of people coming in through the incarceration system who really should be going to a mental health hospital or drug rehab or, for trauma. And we do have a system out here that is looking into doing or actually instituting what's called mental health court. However, we're still finding that even with that, it's not in all counties. And many of those who have mental health concerns and who are under treatment when they go into the incarceration system are not being given their medications or their treatment being followed by, even though it's been documented, sometimes up to a month or so. So I was wondering what was going on in your area of the world and if there's, been any advancements as far as the treatment of mental illness in the incarceration system.
Personally, I don't have any current experience in what is being done, but I have been made aware that the Washington, D.C. is paying more attention to the mental health issues related to those persons who require police intervention. So they are attempting to increase training and more sensitized to the potential mental health problems of potential of residents. And when you have a chance, and this is for everyone, you can go to the webinar that we had last week with Judge Drake.
Yes.
And for the state of Florida, she instituted a mental health court. And I believe it's still in progress. So not all states are as progressive as Judge Drake or as Ms. Bruce out in Colorado. They're just starting to really not just acknowledge the connectiveness between mental health problems and aberrant behavior, but also that the police officers and the correctional system can do a better job of providing safe care to those that are found under their authority.
It sounds like they need, the way being a nurse, we have to have a certain amount of CEUs. It sounds like we need to have someone go into these different facilities and give mental health clinics or mental health education, and they need to be required to have this to make sure they're up to date, cultural sensitivities, different things like that in the prison system for the workers. Is anybody doing that, or is that a requirement?
So to offer a little framework first, in most of your jails and prisons. A lot of your healthcare, physical, the healthcare, mental health, dental services, and pharmacy services are typically done by contract services.
Oh,
There are organizations, there are companies who bid on systems, either a state prison system or an individual county jail to provide those services. And all of those RFPs that go out, or those requests for proposals that go out, there's always those 4 elements: dental, physical health, mental health, and pharmacy services. What they seek from those companies is really going to be based on the budget that they've been given to work with. So the federal system has a totally different system. Take them out. Go with your state system or your local county jail. Within those facilities, there's always at least 1, maybe 1.5, sometimes 2 mental health, trained mental health counselors. And then there's always access to a psychiatrist. A lot of what we're doing now in our larger systems is telemedicine. A lot of mental health services inside are now being done via telemedicine. So to answer the question for Ms. Robin is that I can tell you for sure that part of our health screening, all of which is done usually within 4 to 6 hours of you walking into a door, part of that screening is going to be a mental health screening. We will also ask you, are you on any current medications? If you are, and we don't have them in our system, we will either try to get them or from an outside pharmacist, or we will do the best we can to try to get them as soon as we can. Because what we don't need is an interruption of services. Now, for a county jail, because there's an arrest that's made, we don't know what we're getting off the street. So then now we're dealing with a lot of detox. Whereas in the prison systems, we're not dealing with detox. So you've got to think about the fact that we don't know who we're getting. We're just getting Joe Black, the prisoner who may have come from so-and-so county jail, who is now going to serve 5 years. In your county jail, you're getting Joe Black, who just got arrested, and we don't know what he's been doing the last 5 days. So I say that the services are being offered to the best of their ability, but just like Dr. Broadneck said, it always, always, always is going to come down to what budget that system has and what they can. Colorado is well advanced. They have an excellent reentry system out there, and they've been taking the lead along with Texas for a while in terms of what reentry should look like, what those mental health courts should look like. And there are people who are trying to duplicate those, but that's not always going to be the case. So it does vary, but we are well aware that unfortunately our system has become the default mental health treatment centers, and we just don't have the infrastructure for it.
wow. Okay, I have a question for Dr. Broadneck. This concerns me. We talk about reentry, but what about when they leave, when they are released? Is there some type of rehabilitation plan in place to help women reconnect with their families, get a job, continue to have some type of normal life after they are released from prison?
Some women are sent to transitional homes or halfway houses. It is mandatory that they secure employment while they were incarcerated. I mean, primarily in prison. Most complete their education if they have not, if they dropped out from the secondary school. You would hope that there would be some kind of reconnectedness to their families, but it's not always the case. The primary services offered are the employment services, use of mental health counseling, and education. And when they need health services, they are generally referred to a clinic setting so that they won't have any interruption in their care. Or if they need medications, they're giving And again, I hope I'm not speaking out of turn, but they're giving a 30-day supply of medications or the ability to obtain a 30-day supply. And within that 30 days, it's expected that they would obtain an appointment so they can have follow-up care. But in this era of COVID, the statistics have not kept up. And you know how difficult it is for us to get an appointment.
Yes.
And so if you don't have some type of emergency situation, it may take you more than 30 days to secure an appointment. So again, the system is working within the overall societal demands of healthcare. Doctors left this system, left medical services. Nurses left medical services. So it's a shortage all over, and places like a prison and release and reentry suffer more so than general society.
Wow. Thank you so much for sharing. So at this point, we have Miss Jones, Miss Penny Jones. She's with us today, and I'm just so grateful that she is on the call today to share with us her lived experience of experiencing the correctional system. Could you please explain to us, tell us your story and how it has affected your life, Ms. Jones? Trying to unmute her mic. Ms. Jones. Okay, I cannot get her to unmute her mic. Damika Jackson, could you speak, please?
Hello.
Okay, hello, Ms. Jones. How are you doing today?
Oh, I'm great. How are you ladies?
Thank you. Thank you for joining the National Black Nurses Association. Could you please share your lived experience of the correctional facility? Could you tell us how it affected your life and your family?
Okay. Through my experience, yes, I made a mistake in my life. And when I did go, I learned that that wasn't for me when I was incarcerated. But when you come out, you don't have that help. You do your time and they still look at you like you're still a criminal because you have a felony. You want to get educated and get in a high rank like everybody else. But they put, that felony on you. Just because you made a mistake in life one time don't mean you have to make it a second time. Because I went in 1990 and this is 2020 and I never looked back because I was determined. This life is not for me. But some ladies might need a little bit more help than others. But I still feel like I'm a criminal trying to survive because of that felony over 30 years ago. And it hurts me today because I want to be like up in the high rank like you ladies, but because you have a felony, you can't get this certain job. So that's like putting the ladies, shooting them down, and they're not dumb women. Some of them are smart, some of them need a little bit of help, but because they put a tag on us, we can't succeed. So they go back out in the street because you had a felony once, and they need to give people second chances that had a felony.
I have a question. When you were released, was there any type of rehabilitation program in place to help you?
No, not at that time. Not at that time. And every time you put in an application and want to get back out there in the world, oh no, they deny you from the job because you got a felony. And I don't think that's fair because you still did your time.
Yes, I understand.
So that's like sending them back out there doing drugs and like they're giving up because the system gave up on them.
Yes. Oh, okay. Thank you. Thank you so much for sharing your experience. Damika Jackson, as a family member, could you please tell us what was it like being a family member, witnessing and experiencing this, and how old were you at the time?
Good afternoon, ladies. I think I was probably 11 or 12 at the time. And as some of the doctors stated earlier, that was during the crack era, the crack cocaine era within the Black community. And it was one of those things that I was already affected because of what was going on with our family, but she's like she's my favorite aunt. So it was one of those things like was shocking for me as a preteen. And then my mother and family members stepped in to help take care of the children. And so it had a major effect and impact. I just was like in shock because regardless of the life that she was living, I didn't want to see her behind bars. But I did know that that ended up helping her to get clean and having a better life. So I kind of was torn at that age.
How many children was involved?
I believe at that time, Aunt Penny, I think there were four children at the time that she had. She has a total of 5 now.
Okay, thank you so much. Did it make you change your life decisions and your job and your career, you know, the direction you wanted to go in your life as a result of experiencing this with your aunt?
Actually, yes. Because again, because of that era, I decided to not get involved in a lot of the risky behaviors. And I wanted to make sure that I stopped those, as we say in the African American community, those generational things that have transpired. And it made me want to actually go into psychiatry or into psychology, one of the fields, in which I did. I actually ended up going into psychology, and that's why I'm working on a doctorate in it, because of those experiences that I've had with my family.
Thank you. Thank you so much for sharing. And Ms. Jones, thank you so much for sharing your lived experience with the National Black Nurses Association. You are so appreciated. You really are.
Thank you.
Yeah, thank you. And I have Ms. Barnes. Ms. Barnes, would you please share with us your thoughts, because you wrote something in the chat box that was so profound. I couldn't possibly read all of it. So could you please share that with the group, please? I think it's Tribbley Barnes.
Yes, hi, good morning.
Good morning.
As I stated, I really am just going to read what I wrote to you because I feel like my emotions will overtake me and I might not be able to get across what it is that I was saying.
Okay.
But I would like to give praise to the programs provided in some jails and prisons, because recently in my family, the spiritual and emotional teachings that are available and provided that were available and provided to my niece was what guided her to a new perception of what her life could or should represent. Unfortunately, and unknown to her, after 1 year of being and working in a positive frame of mind,
Yeah, I can't see.
wasn't aware.
Yes.
Sorry, she wasn't aware.
Okay, no worries.
She was not aware that she was being diagnosed with a terminal illness.
What was your name? You said Smith?
Dora Smith.
And
Oh my
she
goodness.
passed within 3 months. But in her final hours, the thing that haunted our room was that she said that she what provided the peace for her in her final hours while being incarcerated.
Wow. Thank you.
So,
Go
I just
ahead.
wanted to, like, there's a lot, that is going on and that can be perceived, from the jails and the prisons. But, there is a lot that's being done on the positive perspective. And, whatever we can do to help promote, and support those things, would also, I believe, add to what the nation is seeing and possibly even give more credence to the fact that they're human, and we need to really know what the perspectives are, of those persons, why they're there and what they may need when they leave.
Thank you so much for sharing. And last week, Dr. Broadnax, if I remember, we touched on end of life last week. What happens when someone is terminal and they get to that point? How do they handle it? Would they let the family members come? Usually, I think the question was they would take them out of facility, have them in a hospital, and at some point, yes, they would let the family be there with them at the end within guidelines, but they will let the family member be there at the end. And which I think is good. Dr. Broadnax, did you want to speak to that a little?
There was a question in the chat about educating students to be to actually have a clinical rotation in a correctional system.
Right.
My recommendation for that is that you really need to have an introductory lecture on care of incarcerated persons from someone who is experienced in that area. It's not enough to read from a textbook or even to get recent articles. The lived experience of a nurse who has actually worked in a prison would do more to sensitize students to, yes, these are residents of our municipality and they deserve care. Because one of the goals that we wanted to have, I wanted to achieve in conducting this series of webinars is to sensitize our members to what you can do to improve the quality of care delivery to persons who are incarcerated. Because so many families have been touched by persons within their family who have been touched by the criminal justice system, that there are a lot of people suffering silence. So we are uncovering the issue for our members and to encourage our members to get involved. You know, maybe you're not up to visiting a prison or a jail, but always there are policy avenues for you to get involved in. But we can no longer just stick our heads in the sand and just say, it's other people, it's those people. You know, my family is not involved in the criminal justice system because it touches all of us and thereby touches the community.
Thank you so much. I want to go to Ms. Claudia. I apologize, it took me a while to get to you. You have your hand raised. Could you please open your mic and speak, Ms. Claudia?
Yes, thank you. Actually, I do appreciate Dr. Broadnax's comment. The question I have is for Ms. Jones or Ms. Barnes, and that is, from the lived experience, what do you think nursing or healthcare should do for incarcerated and post-incarcerated? From your lived experience, what didn't you have that you would have needed? And what don't you have now that you are post-incarcerated?
Ms. Jones?
Yes. Oh, at the time, I didn't have mental health, which now I do go to mental health. And I feel like just because first-time felon ladies go through life, that they should give them a second chance in life. I think everybody deserves a second chance because we all make mistakes and we're not perfect. But sometimes the system throw you up under the bus too. I think they can do better by helping women that go to incarceration, because when they want to do better and they go through their experience and then the system is not there for you when you need a job or you want a high-tech job, and it breaks you down when you put in your application and then you say and try to be honest and say, are you a felon? And you say yes, but then they never call you. They don't want you. So actually they throwing you away and say, oh, make it the best way you can. So through that experience, I had to get odds and end jobs to survive for my family, because they only allow me to get certain jobs to take care of my family because I'm a first-time felon. And I wanted to have a TV show of first-time felons. Like, they shouldn't hold that against you because you did your time, and everybody need a second chance. Now it's different if you go on and on, you don't commit 2 or 3 times. Yeah, that's a different story. Yes, they need mental health. But for the first time, there are some women out there, first time fellas that want to make it and survive for their family, like you ladies, and have a good income, but the system is not backing us up. So we don't have no other choice but sell your body or sell drugs. And then they wondering why these women out here doing more drugs, because that they doing the best that they can. Because the system is not there for them. Who's there for them but the streets? Basically, they got to survive one way or another. And then that's probably even with the men. They don't give them a second chance. They are human and somebody else too. Everybody that makes a first time felony ain't all bad. It's just mistakes.
Thank you. Thank you so much for sharing your lived experience. And I think it's Robin Bruce. She wrote in a chat box, she says, so true. The U.S. is unaware that once you receive a felony for any reason, you face a life of incarceration without walls. We need strong women like you, Ms. Jones, who are willing to share your lived experience to push a change in our legislation. And that's basically what we need to do. We need to get the right parties in place in order to, like she said, everybody deserves a second chance. So thank you so much for sharing your lived experience. We also have another question in the chat box. Did Ms. Jones also have problems obtaining rental housing? Ms. Jones, did you have problems with housing after, post-incarceration?
Well, no, with that situation, I had a husband. I ended up getting married and my husband provided, even though I helped with odds and ends jobs. But you know what I'm saying?
Yes.
They hold you from a good job. Like you can't get no state jobs, or they only allow you to have so much. But because of the grace of God, my husband was provided. I didn't really, it wasn't so bad. I had a helpmate.
Yes, I understand. Thank you so much. So at this point, I want to turn it over to Dr. Broadnex to kind of summarize everything as we close out our webinar for today. I want to say thank you so much for Ms. Lori Reed for sharing your expertise and for us to see how important mental health is. Very important. Getting someone to try to get a contract to go in and teach all of these people in the prison something, for them to come up with a rehabilitation plan is also important. So Dr. Broadnex, could you summarize and close us out, please?
Yes. Thank you so much, everyone, for being on the call today on the Zoom. And thank you, Ms. Reed and Ms. Jones and Ms. Jackson, for sharing your expertise and experience with us. We hope you've learned a lot from our discussion. But we started off with Dr. Neal giving an overview of statistics. And what we're finding as a result of her statistics is that things vary from state to state, county to county, as well as the federal stats. So you need to know what's going on in your community. We also were surprised to learn, at least I was, that the numbers of white women who are being incarcerated is increasing as a result of their participation in drug activity. And again, it varies from region to region in the country. We talked about the healthcare needs of women who are incarcerated, as well as what happens to women who are pregnant and deliver while they are incarcerated. We didn't get a chance to go in depth with what happens upon delivery and what happens to the infant, but we know, once again, everything is driven by the budget. And again, we cannot thank our guest who shared what happens upon release from prison and how it's so difficult for persons who are released to get a second chance. Everyone deserves a second chance at life. And when you're incarcerated, is not as a result of your being, I'll just say, a bad person. It's you've made a mistake. The overwhelming need, once again, is for consistent mental health services and education of the correctional administrators. So there is a role for the National Black Nurses Association and each chapter throughout the country to participate in improving the overall health care of incarcerated persons. So hope you have enjoyed and learned today, and stay tuned for next Wednesday. We look forward to everyone being on the call.
Thank you so much. And our next topic on the 21st, impact of incarceration on families and the community. And on the 28th, our last ending the series, that would be 5 weeks. It is called Mass Incarceration. We realized this topic, there was no way you could do this in 1 hour. It is so much. So we decided to do it in a series of 5 different webinars that touch on various topics. And on the 28th, we have an organization, and that's what they do. Their sole purpose is to help people after incarceration. And we will try to connect them with you, Ms. Jones, because I think that would help. So thank you so much for joining our webinar today. We hope you enjoyed it, and we hope to see you next week for Wisdom Wednesdays.
Wait a minute, evaluations.
Oh,
Yeah.
yes, please fill out your evaluation forms to tell us if we're doing okay or if we can improve. That's important. Goodbye, everybody.
Bye.
Goodbye.
Have a great one.
Thank you.